Good morning and welcome to the Clinical Trials Guru. Again, if you want to reach us, you can reach us at theclinicaltrialsguruvideo2. Hey, my name is Don Walters and welcome back. Listen, we'll make this quick. We had a question on what is a clinical study. A clinical study is basically a scientific study on either medication or treatment and how it works in the individuals or on people or the population. What you're typically looking at is trying to find better treatments or better medication for treating a lot of times chronic illnesses. Um, Clinical studies are broken up typically in four different parts, and I'm talking about for human testing, or they're broken up to four different parts, and they're called phases. You have phase one, phase two, phase three, and phase four. Phase one is typically a lot of times started out with what they call healthy, normal people, and that's usually people that may not have that particular illness. Um, they'll go in and test the medication. A lot of times they're looking at efficacy and safety. Once that's done, they might still within phase one, but a lot of times going into phase two, they'll look at a small group of people that have that illness and see what kind of response they get back. If they're getting a positive response, people are responding well to this treatment or medication, then they'll move on to the next phase. But before they can move to that phase, they must feed that information back to the FDA. Once that's done, the FDA says, hey, this looks good, it's working, then they'll move on to the next phase. Now, this has been my experience working with these studies. Um, when you get into phase typically two to four, again, they're looking at people with that particular illnesses. But as you move along the phases, especially going from two to three, you start increasing the geographical area and the number of people that you're conducting these studies with. A lot of times they like to look at different, even ethnic groups, different groups of people to see how they're working. Um, Once they get a response back and that response looks positive overall, the FDA will either approve that medication to go on the market or not prove it if it's not doing well. When you hit phase four, a lot of times you're talking about aftermarket studies. A lot of times these studies are done either they're looking to see how they work in adjunct with other medications, or maybe there's other treatments that they found that this medication might work well for. Um, I think that's pretty much it. I mean, obviously there's a whole lot more detail there, but we don't want to get into that. We don't want to bore you with that. That's not the purpose of this. Again, we thank you for contacting us. That's an excellent question on what a clinical study is and what it consists of. If you have any further questions, please again contact us at the clinical trials guru, the clinical, I'm sorry, theclinicaltrialsguru.com. And my name is Don, and I'm signing off, and have a wonderful